day and welcome to Asake Online. My name is Sizwakele Ndlovu and this is the Breakfast Club. Today on the show, I'm going to be talking to Dr. Norman Matara, and he is the Secretary General of the Zimbabwe Association of Doctors for Human Rights. So welcome to the show, Doctor.
Good morning, listener.
Doctor, we're just going to go straight into the topic of the COVID, and we've had consignments of the vaccine coming in, but we've had low uptake, and we've heard all these conspiracy theories about not being effective, coming from China and causing sterilization. What is your take on these conspiracy theories?
Well, yeah, we have a lot of skepticism, myths, and misconceptions about the vaccine. But these are not based on any scientific evidence. They remain just as they are myths and misconceptions. You know, I think it stems from how our people view goods that come from China. We always have this stereotype where we view the goods coming from China as second-hand or as of low quality. So this also was also a factor in terms of the vaccine. People actually thought that the vaccine is something which is of low quality, which is not effective, and which has got a lot of side effects. But when you then go on to look at the scientific evidence, because this vaccine have actually undergone trials, phase 1 trial, phase 2 trials, we actually even have data from phase 3 trials. It actually shows that the vaccine is actually safe. The vaccine is actually effective. And at the moment, you can see that it has now been used in almost more than 20 countries. More than 50 million doses of the vaccine have actually been inoculated into people, and we haven't received any issues in terms of major side effects or any adverse events. So it remains WhatsApp talk, social media talk that these vaccines are not of high quality or are not effective. But scientifically, they are actually very competitive, and they are safe, and they are effective.
In other parts of the world as well, there have been other vaccines that have been tried out, and people have also expressed skepticism about those types. I think the ones from Europe as well. So it's not just about Chinese. People generally, would you say, have just a skepticism about new stuff, and especially in terms of medication and vaccines?
Yes, there have been a movement of anti-vaxxers that have been pushing an anti-vaccine campaign. So it's not only the Sinopharm and the Sinovac vaccines, but even the Pfizer, the Moderna, especially those ones which have used a technology of mRNA, which is the first vaccines to use that technology. We have seen that people have been peddling falsehoods and myths and misconceptions against those. We also have a bit of people coming in from the religious side of things as well, actually preaching that these vaccines, some of what the scripture in the Bible says about in the Revelation, where they talk about the 666 and things like that. So you see also that it's also contributing to this movement of people who are skeptical about the vaccine.
What would you say are some of the common side effects that have been experienced so far? You did mention that there have been no adverse effects so far reported. But when somebody has that first vaccine, what are they likely to expect? It's just some of the things so that one doesn't get worried.
Okay, yeah, so we have what we call local side effects. Local meaning the injection sites. So you can get pain from the injection area. The injection area can also swell. You can get redness and swelling. And then you've got systemic side effects where you can get headache, chills, fever, muscle aches, and muscle pain. These are the common side effects that someone is expected to experience. Usually you experience them within the first day up to the third day, and after the third day they're expected to go away.
Okay, you had a tweet where you spoke about the second part of the vaccine, because as we know, the COVID vaccine is being administered in two parts. You get one injection, and then is it 2 weeks later you get the second one. You had a tweet where you said that the second vaccine might actually make you have more severe side effects, and that tweet then became a national headline. What's your comment on that?
Yeah. I was actually surprised when the tweet was actually put on the front page of a national newspaper. And of course, I was happy that the information is getting out to people, but I was also worried in terms of how that information was portrayed in the newspaper, because it came out as if we were saying that the vaccine is something which is dangerous because of those side effects. But what I was trying to get out to people was to say that because the science behind the vaccine is that if you are getting injected with the vaccine, your body will see that the foreign thing has been injected in me. It will mount what we call an immune response, thereby producing what we call antibodies. And those antibodies are the ones that will protect you if you are then exposed to COVID-19 in the future. So the production of antibodies is what we want the vaccine to do. And by producing antibodies, that is how those side effects that we are talking about comes about. So when you're talking about fever, chills, we know that it's the body which is responding to the vaccine, and it's actually doing exactly what the vaccine was intended to do. So we were trying to give people sort of a heads up to say that if this happens to you, do not worry, do not start to think that it's the vaccine which is causing illness or it's something which is bad. But you should know that it's actually a very positive sign. It actually shows that your body is responding to the vaccine and is producing those antibodies that will then protect you in the future, which is exactly what the vaccine is designed to do.
Also, with other vaccines, you do get reactions like that as well. It's not just for the COVID vaccine. So you do anticipate a reaction anytime you inject a vaccine into your body.
Exactly, because the system is the same, the immune response is the same. Actually, if people know when they vaccinate their babies, they actually get sick. Those babies, they actually get maybe a fever, a temperature may rise. It means that the body is now trying to respond to the vaccine that would have been given. So it's not only COVID-19 vaccines, but any other vaccines can actually produce those sort of side effects.
So would you recommend mandatory vaccination to curb the slow uptake of the vaccination? What's your take on that?
Yes, there have been talk about introducing mandatory vaccination. Personally, as a public health professional, I think that it is not good practice to introduce mandatory vaccinations or any mandatory giving of any medicine. I don't think it's good clinical practice. What we need is to convince people to have a buy-in from people so that people make an informed decision to actually uptake these vaccination voluntarily. So with all medicines, we think that the best way is for people to voluntarily take those vaccines or any other medication. However, even though we push for voluntary vaccination, there are some privileges that people might actually be forced not to access if you are not vaccinated, because if you're not vaccinated, you become a public health threat. So these issues of COVID-19 passports, COVID-19 certificates, where you cannot access some freedom, are things that are very possible in the future. And it's not only with COVID-19 vaccine on. You know that if you want to travel outside the country, there are some countries they will say you cannot enter our country if you don't have a yellow fever vaccination card. It's something that has been happening and people do not complain. If you're coming from, let's say there's an Ebola outbreak somewhere and you're coming from that, you need to provide proof that you are not infected because become a public health threat. So this is something that can also go ahead with COVID-19, where people may not access certain services if they are not vaccinated. So people have to know that it is their right to get vaccinated or not. It should be voluntary, but they should also know that if you are not vaccinated, there are some services which you cannot access. It's mainly due to protect other people, and it's a public health measure that has been happening before and can still happen in the future.
So as a frontline health worker, what have been some of your challenges and the challenges of your colleagues in fighting the scourge of COVID-19?
Yeah, so as health workers, our problems are mainly, I can put it into health worker related problems, then I can also say there are general problems. So the general problems are the same that everyone has been facing, with lockdowns with lockdowns, business is shutting down, the economy shrinking because of COVID-19, and also even socially, where you cannot now socially participate in outings with your friends, families, and things like that. They've been affecting also health workers in as much as they've been affecting everyone. Then also as health workers now, people working on the front line with problems mainly where we're exposed to the virus, the issue of lack of PPE in hospitals, as well as low remuneration. It's things that affected many health workers. But above all, it's the stress that comes in with seeing people dying, especially when we're in the second wave. It was a mentally traumatizing experience for most of the health workers, especially those who were working in intensive care unit and the critical care unit. Because with COVID-19, you essentially see someone, fit person, deteriorating in a matter of a few days. Someone came in fit, talking, and in a moment they are gasping for air. You try to intubate them, and they are gone within hours. And so having to re-experience that, I think it caused a lot of mental trauma on workers.
How have you coped with all the mental stress and, well, also being a frontline worker, and you've just outlined that you are seeing people dying, and also you have the added burden of having to go home and people having looking at you, possibly finding like, are you carrying it today or not? How have you managed to deal with the mental stress, and what would you recommend to assist other workers and just the general population in dealing with this mental stress that we are just burdened by?
Yeah, it's a quite a very big challenge for most healthcare workers, but for us as doctors, have to we actually started conducting what we called wellness sessions, which were being conducted almost every Wednesday on Zoom, where we have someone with experience in counseling, talking to people, trying to make them manage that stress. And also as an association, Zimbabwe Association of Doctors for Human Rights, actually at the facility where we're providing psychological counseling sessions for frontline healthcare professionals so that they can try to deal with the pressure of dealing with COVID-19, the mental trauma that comes doing such work.
Let's talk about home remedies. From the time the pandemic started, we've read about bicarbonate of soda and lemon, zumbani, all these things. Do home remedies actually work?
Well, yeah, there have been a lot of discussion about home remedies, and when you say actually work, it depends on work to do what. What are you aiming when you are taking the home remedy? Because you will see that there are some home remedies that can actually work in terms of trying to relieve the symptoms of COVID-19. For example, steaming. If you are steaming, especially when the disease is still in this mild form, can actually relieve some of the symptoms, but it doesn't mean that steaming kills the virus. It doesn't mean that the virus go away by steaming. You can just maybe relieve the symptoms, but you don't make it go away. It's also that's also similar to things like garlic. What people have been taking, things like bani, which have been shown to have some antioxidant properties, but it doesn't mean that it actually kills the virus. It's something that can actually relieve symptoms, but does not kill the virus. So in terms of working, it just depends on what work you want to do. If you think that the money kills the virus, then that's not possible. It doesn't work that way. But if you are in terms of maybe relieving some symptoms, then yeah, it can work to do that.
So essentially, the home remedies are helpful in alleviating the symptoms, Chete, and not killing the virus. So you can go ahead and use them, but as long as you get your proper medical attention and use them as a supplement, would you say, to then alleviate symptoms?
Yeah, that's very true. Some people you can use them, but you should know that you are not curing the virus. You can actually develop even severe even after using. But in terms of relief of symptoms, yeah, it's no problem in using some of them, especially like things like garlic and things like that. But then there are also other things that we even not recommend, things like bicarbonate soda and things like that. Those ones have not been shown to offer any symptomatic relief or any use in terms of COVID-19. So those things are not useful at all.
While on the subject of treating symptoms and alleviating them, there's been a use of alternative medication like ivermectin and things like that. People are self-medicating. Is this recommended? What's your take on that? How would you advise people who have COVID and are trying to cure the disease, as it were, with all these other drugs that are proper drugs but haven't been, would I say, gazetted to treating COVID? What's your take on that?
Well, I think for everyone who gets sick, the best way is seek advice from a health professional. You do not have to self-medicate. You need to seek a proper consult where you are consulted and have any medication prescribed by a health professional. With ivermectin, with the COVID-19, there were a lot of issues in terms of people running around to try and find a treatment or a cure for the disease or anything that can improve the outcome. And they can talk about ivermectin as well as other medications like nanosip. But in medicine, we use what we call evidence-based medicine, meaning that we need to see the evidence of the efficacy of that medication. And with things like ivermectin, the evidence has been non-conclusive. There haven't been any strong evidence to point out that it's something which is useful or efficient in treating COVID-19. Even the company that actually make ivermectin, which tends to benefit financially if it was something efficient or useful in treating COVID-19, actually gave out a statement to say that in all the research that we've done, we have found that drug is of no use in terms of treating COVID-19. And there are still ongoing studies that are being done to actually ascertain if this is the correct position. And those studies show that ivermectin actually work. Then we would then recommend it to people, but at the moment, not have conclusive evidence to recommend it. And we do not advise the use of medication because for the past week, we've actually been seeing, I think one of the professors who have been attending COVID-19 patients at Zimbabwe Isolation actually wrote out to say that they've seen an increase in terms of ivermectin toxicity. People who are self-medicating and in the process getting them. So those cases are actually on the rise, and we urge members of the public not to self-medicate, but to seek a proper consult with a health professional.
There's been a release of people to be able to go out as a business, easing of lockdown measures and things like that. And schools have just recently been opened for across all grades, ECD up to tertiary level. What would you say is the issue with that? Are we ready to have children going back to school? Because somewhere, some medical personnel said that children are what you call vectors. They can carry the disease, but then they'll pass it on to somebody else who then manifests the symptoms. Was this a good move to actually open schools? Because we've got the right to education and the right to health. Which should we be balancing at the moment?
Yeah, I do understand that there's always a risk posed by making people go back to school and by easing lockdown measures. But we also need to know that in spite of the pandemic happening, people still need to go on their lives, like especially children. They also, that's right, they've not been going to school for almost a year. And this has a major impact on their lives as well. So it's something that I think it was now the correct time for children to go back to school, considering that most of the cases have actually gone down. But there still needs to be more of preparedness, especially in the teachers and other education staff, which are the elderly, who are more prone to severe disease. We think that we need to increase the number of vaccinations for teachers, get teachers vaccinated, members of staff vaccinated, and then children can still go to school. We also need support for areas like having more sanitizers, face masks for those schools, especially in rural areas where children cannot afford to get those things. So we think that it's something that we can balance between the two, both the education and the healthcare, because these are things which are all important. There is no way where we are going to have zero infections in the near future. We cannot get to that point. So we still need to make sure that children still receive their right to education.
So to round off our conversation, you are the Secretary General of the Zimbabwe Association of Doctors for Human Rights. Can you tell us more about this organization and what you do?
Zimbabwe Association of Doctors for Human Rights, it's a membership-based organization for health professionals, which was formed in 2002. And we seek to advance the right to health, being the highest attainable standard of physical and mental health in Zimbabwe. So we deal with quite all health issues that affects the community. We carry out projects. For example, we've been doing COVID-19 projects. We are doing a project on gender-based violence, where we are trying to educate medical practitioners on how to examine and treat a victim of gender-based violence, as well as to educate the community on the health consequences of gender-based violence. We also do a project on early and post-child marriages, and we also respond to victims of organized violence and torture, where we actually provide medical and surgical services for those victims. So those are some of the projects that we do. But our main objective is to advance for the rights to health in Zimbabwe and beyond.
Okay. So as one last question, so if somebody chooses not to take the second jab, what are the effects of not taking that second vaccine, of the COVID-19 vaccine?
So there isn't any health effect, like to say you get sick or anything from if you don't take the second jab. No, there isn't any health effect that can happen to your body. But what happens is that because the first dose you do not raise as much antibodies, it means that you will not be protected from COVID-19 in the future as someone who got the second dose. So there is no harm in not taking the second jab, but it essentially means that you are just as you are just similar to someone who didn't get vaccinated. You are not protected at all. So we encourage people to actually go and get the second dose, because it then offers you immunity from the coronavirus.
So I believe you are speaking from experience. You have taken the jabs, and have you had any adverse reactions?
Yes, I took the two doses. The second dose was on Tuesday, and I think the main effect that it had on me was a little bit of pain and some fever. I actually could not get into supermarket that evening after the jab, because I had a little bit of fever, but it was gone the second day. By the third day, I was totally fine.
So you've survived,
Yeah,
basically.
yeah.
So would you have any parting shots for our viewers now watching the show?
Yeah, I would like to encourage people to participate in the vaccination program, especially the elderly and those with comorbidities. Vaccinations have been shown to be safe and effective. We've eradicated a lot of diseases like smallpox, and we've actually managed to control other diseases, measles, diphtheria, all those diseases were controlled after the introduction of vaccine. And COVID-19 is not the first pandemic that the world has actually witnessed. We've witnessed other pandemics as well, and most of them have actually been controlled by the introduction of vaccine. So with the coming in of the vaccine, and if it is made available to you, we actually urge you to take that vaccine, because it is our quickest and safest way of returning to normalcy, where we do not have these continuous lockdowns, where we do not have high-stage infections. So basically, these are something which everyone should be eager to participate in the vaccination program.
Dr. Norman Matara, thank you so much for being a part of the Breakfast Club. You've given us so much informative tidbits to take away, and would like to thank you and wish you all the best as a frontline person and as a Zimbabwean just battling COVID-19.
All right. Thank you very much for watching me on the show. I hope it was informative for listeners.
It definitely was. I did enjoy it, and you answered quite a few questions, especially on the home remedies part. So thank you. We wish you all the best, and do take care. That's all from the Breakfast Club, and my name is Sizwakele Ndlovu. I hope you enjoyed this edition, and it covered issues of the vaccination, your first vaccination, your second vaccination, and just the process and what to expect with the vaccination. So many people who have suffered from COVID are encouraging others to go out and get the vaccination. And spirituality aside, it does seem to make sense to just protect yourself, because other vaccines have come and gone, and we've been able to beat world pandemics like polio and things like that from vaccinations. Still, it is your right to do as you will. With that said, that's all for now. This is Asake Online. That's all for now.